So, just out of curiosity, how do you convince the mainstream physicians and caregivers? They're really a source of referral. They sometimes actually control patient referrals because patients in general may not know that you exist or your services exist or that there's a world beyond mainstream healthcare. Because at this point, holistic care and integrative medicine isn't thought of by patients in general as the first train of thought. They think of chemotherapies, they think of interventional therapies as the way they're going to get cured from their prostate cancer or their other malignancies. So how do you approach a healthcare provider and explain the benefits that you can offer to patients so that you can get these patients the full service care that they really need?
How did you and I meet, Dr. Lutz? I don't remember.
Because of our foundation many, many years ago.
So, first of all, I just want to let people know we're in Bloomfield, and our website is sort of in that. Oh, no, it's not in there. It's aimnatural.com. So it's Associates of Integrative Medicine, natural.com. But 80% of our population, actually, Dr. Lutz, is direct referral from oncology or urology. And I think the reason why is because we have such good outcomes. Patients are happy, and then they tell their oncologist or their urologist that they're happy. So I think one of the ways that people like ourselves need to build is to really focus on the patient in front of you and have good outcomes. It helps to do in-services. So when we have time, we go visit urology, we visit oncology, and we talk about what we do, papers that we might have published or data that might be coming out. We do a ton of public speaking with organizations like the Men's Health Foundation or Gilda's or Mioka, any of these not-for-profits that work in the space of education and cancer. I would say we speak almost bi-monthly, and we try our best to, in those settings, to connect with oncology and urology and give them a sense that we're not competitive. The problem with Michigan is that you're fairly vulnerable in Michigan because there is no regulation around the term holistic, integrative, natural. It doesn't mean anything. So anybody in Michigan can call themselves holistic. And that can be dangerous whether they're an MD or whether they're a herbalist, veterinarian. I'm not saying that any of those things are bad. I'm just saying everybody claims to be an expert in this field and nobody regulates it in the state. So I have had prostate cancer patients who have come to me and they've been seeing a large animal vet and getting medications that are intended for horses that can be dangerous to them. So it's frustrating and difficult for the patient who's trying to navigate that. You're looking for someone who has the letters FABNO after their name because that means that they're boarded in integrative oncology. And I think educating providers like urology and oncology that we're out there, that there's 4 or 5 of us in Michigan, and that we're skilled in seeing their patients and we work in conjunction with them, I think is the trick. The problem with urology and oncology is they're rightfully so, they're wary of the quality of care, the skill level, the expertise, and the risk of contraindication, particularly with chemotherapy.